John, thank you very much for inviting me to speak. It's a pleasure to be here, and it's actually a relief to be here as well. Thanks, Qantas, for cancelling our flight. I did make it. So fortunately, Joan has explained what a plastic surgeon's doing here. It's quite amusing, really, if I talk to any of my medical colleagues about our farm. They hear the size of it and they say, geez, that's a lot of land. Talk to the farming colleagues, oh, nice little block, and quite a different perspective. So accidental injection with veterinary products is quite common, and I'm sure any of you that have done it will realise exactly why. We don't really understand, particularly with some of the dangerous vaccines, what actually happens and what to do about it. There's definitely a lack of good data, and research is desperately lacking. I've been giving this talk for probably 4 or 5 years now, and the progress to date has been nil, other than my personal experience. I was actually a bit amused about being an expert. I think I've looked after about 6 cases now, and that's more than anybody else in Australia. It makes it quite amusing, really, that I'm the expert. So here are the products of major concern. Gudair is the Johne's disease vaccine, which you probably all know about. Its main ingredient is a mycobacterium, which is the same family as the tuberculosis bacterium. That if you guys are fairly lucky here, you don't see tuberculosis, but in countries where you do see it, you see some pretty awful consequences. One of them is the mats of really awful scarring and what we call granuloma formation, a chronic inflammatory response that you get in tissues. And then you add mineral oil to it, which is even toxic on its own, but together they really are appallingly irritating to tissue. It is not a specific vaccine, and for the life of me I can't understand, and I'm still waiting for industry to explain to me how it can work. Basically, you beat the bejeebers out of the immune system and say, right, you protect it against Johne's. How can that work? It's not specific for Johne's disease. A similar sort of principle was actually used to stimulate the immunity in the treatment of melanoma, and it was a dismal failure. So I'll leave it to the guys in the field and to others to decide whether it really is effective or not. But when you're working with a product that's as dangerous as this, be certain in your own mind that you really do need it. Perhaps I have a little bit of bias in my background because I was of a vintage where we were still getting the injection for polio, and I actually got polio from my vaccination. So I acknowledge a bit of bias there. But for goodness sake, think about what you're doing before you do it. Piligard is another one that is high on the list. It's Clostridium species with Moraxella, but again, the major ingredient is the mineral oil, and that's what really is toxic. I gather that these products are both alkaline. I don't know if you guys realise, but alkalines actually burn tissue a lot worse than acids do. So a couple of facts. I started looking around at the literature a few years ago, and this is what I came up with, and I think this is what had a big impact on you, Joan. An average patient who accidentally injects themselves will be off work for 8 months and have an average of 6 operations after a Gudair injection. That's big. So there's a lot of confusion. The general advice that you read on package inserts is get advice from your doctor. Well, I'm the expert and I don't have a clue. And that's true, you laugh. So we really do need to do research. There's a paper which I'm going to show in a sec that says we've got to get on and do early excision. Says who? Does it work? We don't know. It seems like reasonable advice, but our treatment's really based on a few anecdotes, and there's people all over that have done one or two. So when I had my first problematic case, which I'm about to show you, I looked at this at the literature, and I saw that there was a very, very respected senior colleague in Melbourne who'd written about his experience. So I phoned Wayne and I said, "Wayne, what do I do?" And he said, "I don't know, I'll just cut the finger off." And that was the help that I got. This was the paper that I alluded to, and it's the state of the art, and you'll see that it was written in 2006. Well, I know from publishing that it takes a little while before you've treated the case, written it up, published it, so the work was probably done in about 2004. That's over 10 years out of date already. So this is the current literature being quoted, and this is a single case report, and this poor person went back for multiple operations, had skin grafts, and still had recurrences after that. It's not unreasonable to draw the conclusion that this person only presented 3 weeks after the accidental injection, so their conclusion was you've got to get him early. But there's absolutely nothing to defend that position. It's a conclusion that they've drawn, which may or may not be correct. So I'd like to thank Andrew, who is the patient in this instance and a good friend, because when he injected himself, he went and did quite a bit of reading and research, and he was really the one that actually prompted me and my interest, and I started looking around at that stage. So he accidentally vaccinated into his right hand. He went to his GP. As it happened, he knew he was in trouble. He'd read the brochure, and the GP injected cortisone into his hand, which is something that I would not condone. I would imagine that if you injecting into the area after accidental vaccination, you're doing tissue damage just by the fact of injecting, but you're also increasing tissue pressure, and you're probably going to spread the vaccine around, which is exactly what you don't want to do. For the rest, splinting and immobilizing, elevating, yep, that's all good. Surprisingly, on the second day when he went back to the GP, only then was he given antibiotics. Now I know that the antibiotics are not going to actually treat the Guedere, they're going to do nothing to that. But the needle's never clean when you stick it into your hand, it's always been in something else first. So you actually want to treat the secondary infection. On day 4, he came to see me, and I'm not sure exactly what my thought process was, but I looked at this lot and I thought, at this stage, I don't know where the vaccine is, other than it's in his hand somewhere. I needed to localise so that I can remove it. And I deliberately delayed definitive surgery for 3 weeks. I then did a radical excision, almost like a cancer operation. And within 2 weeks, he was back at work, and he's never had any further surgery. Absolute first in Australia, and that's what made me think, well, perhaps the advice that's given is early intervention correct, and I don't think so. So this is Andrew's hand. What I can tell you about this Guedere is that it is painful. It is really, really painful. I had a phone call from King Island just as I was preparing to catch my flight. That didn't happen, and this poor guy has accidentally injected his calf, and he'll be coming to see me when I get back. But he said it is excruciating pain. He's walked through broken toes and, you know, laughed it off. Farmers are generally hurting themselves. They're used to pain. This will drop you. So that looks pretty toxic and nasty. You can see how big it is from the side, and no wonder he was complaining. So this is when I removed it. I don't know if there's a pointer on here. There's a pointer as well. Doesn't matter if there isn't. you can see that I've taken that ellipse skin, and that's that mass that I was talking about, going all the way down into the structure of his hand. My skin hook on there is on the ulnar nerve, which is the major nerve for your the majority of the muscles and sensation in your hand. So you'd kind of like to leave it there. The next was a gentleman who injected his left hand. He saw his GP, given antibiotics. He also reported huge pain and swelling, and he was given anti-inflammatories. At about 3 weeks, the GP lanced it and got yellow custard. Awesome. I don't know what it is about medicine, but I'm going way back. Most pretty noxious sort of stuff was described in terms of food. I think custard at a time like this. So as you can see, I've done a pretty extensive clearance of all of the tissue involved, right down to muscle. And this again was a complete 100% success in a single outing, also delayed treatment. The next is a gentleman who found me in a bit of a panic while I was in my tractor, and he had injected his finger, his left index finger, with the pink eye vaccine, Pilligard. And he phoned the Cooper's vet for advice, and managed, I'm not sure exactly where he found my phone number, but he phoned me, and I said, let's start with antibiotics, oral cortisone, not injected, and some anti-inflammatories. And after about a week, he developed blisters and a sterile pus. We cultured it, and I cleaned his finger up, and he had very, very limited recovery. I actually then went on to amputate his finger, and I want to quote the Cooper's vet, who said to him, well, at least it wasn't good air that you injected with when you phoned for advice. Well, quite a lot of good that was. So this is what it looked like to start with, just towards the end of the index finger. Not terribly impressive, and I thought, yep, that should probably survive. Over the next little while, it got a bit darker and spread a bit further, and it developed this blister and pus, and that's just another view of the same finger, and it just got worse, and it got worse and worse, so I cut it off. In fact, I did offer to reconstruct it for him, but he said, no, Margaret, I've got work to do. And this is a lady who is actually using the safety gun, for those of you who are designing them and developing them, and she accidentally injected her right thigh. She was treated by her GP, but 4 months later, she was still draining, still having problems. So she came to me, and this is what it looked like. Not terribly dramatic there, but it was really a nuisance, painful, and a pain. So what I did was to cut it out, and you can see the extent of my excision. That's quite a big bit. But I did manage to close that for her, and she was yet another one of 100% success. This is what the stuff actually looks like, and it goes quite a long way. The problem that I have is that I only know one person who's had an immediate referral, and that's Steve Salerno, just outside Melbourne. And until then, no one had been able to tell me whether you can actually cut this stuff out or not. And he said he got an early referral, he went straight to theatre, and he opened the wound, and the product is white when it's in the bottle. I don't know what it was going to look like or what would happen to it when it's in tissues. I asked Pfizer many years ago if they couldn't put a blue dye on it or something that would make it easier to see in the tissue, so that if you do go back early, you can see exactly where it is, and then you can do something about it. But they've obviously not seen sense in this and done nothing about it. So anyway, Stephen cut out what he could see, washed it out, and we had a chat about it, and he was very happy that he'd got in early and done it, until about 3 months later when she had a recurrence, had a recurrence, and it was quite a lot further than the original injury. And I have to wonder whether he didn't spread the Guedere by his intervention. This is what it looks like if you cut through it, and the pinkish bit in the middle is this granulomatous reaction that I was talking about. That's reasonably normal fat underneath it. This is my last patient that I want to tell you about. She's a vet from New South Wales, wearing double gloves. Interestingly, didn't know about safety guns for vaccinating. She accidentally injected her non-dominant thumb with about 0.2 of a mil. She looked around for advice. Now, here's somebody in the industry, had no idea where to turn, where to get advice. Found Steve Salerno on holiday somewhere, and so he suggested she phone me. She was prepared to fly all the way down to Tassie, but in fact we managed just by corresponding by email to sort her out. She was advised to have a cross incision made and drainage, and this is what her thumb looked like. That's great. I don't think that, we don't know whether any vaccine went in or not. Listening to her story, probably not. If it did, there wasn't very much. And now she's got a painful scar on the tip of her thumb that's going to bug her for years. So if you're going to do it, I would strongly suggest you don't do an incision like this. Send it to a hand surgeon to make it. I would have done a fish mouth incision just below the nail, so at least she hasn't got a painful scar right in the pressure-bearing area of her thumb. So to summarise, you've actually got to take these injections seriously. Farmers are notoriously terrible for just thinking, yeah, it'll be right, and they just leave it. It won't be taken seriously. We definitely need more research and trials, and I would like to advocate to have one centre which is a centre of excellence in Australia, and then at least one person can get some good experience and come up with some sensible answers. Thank you.